We need to continue to remind everyone that reporting culture improves safety and that events are usually due to a system or process gap. We need to acknowledge and thank the individual who took the time to escalate their concerns and report the event. And there is a clear difference between a system gap and neglectful or at-risk behavior.
You're listening to the Oncology Nursing Podcast, where ONS Voices talk cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast. Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Jaime Weimer, Oncology Clinical Specialist at ONS. And today we're talking with ONS member Klara Culmone, Assistant Nurse Manager at the Laura and Isaac Perlmutter Cancer Center at NYU Langone Health Center in New York, New York, about the factors involved in creating a culture of safety. For this episode, we're focusing specifically on reporting culture. As a reminder, you can earn free NCPD contact hours after listening to this episode and completing the evaluation we've linked in the episode notes. Thanks for joining us again today, Klara.
Thanks, Jamie. It's great to be back.
So to start, can you briefly give us an overview of reporting culture in healthcare institutions?
Absolutely. A reporting culture is where people report their errors and near misses. Adverse events and near misses are common in healthcare. However, unfortunately, they are underreported. According to the Agency for Healthcare Research and Quality Patient Safety Surveys, in 2018, it was reported that 47% of respondents said that it feels like unsafe event reports are held against them. In addition, 50% of respondents indicated that after an event is reported, it feels like the person is being written up, not the problem. We need to work diligently to earn the trust of healthcare workers and shift that mindset. In addition, all levels and roles need to be held to the same standards.
Absolutely. And I think it's such an important topic that we continue to shed light to. I know that it's been brought up in discussion relatively recently with some nurses that are in the media for certain events that have happened. And I think it's just always worthy of bringing up and emphasizing the importance of reporting and also having those reports taken seriously and acted upon in the right way. So can you give us some examples of inadequate safety and reporting culture?
So inadequate safety culture and reporting culture can be a significant contributing factor to adverse outcomes. So examples of that include insufficient support of patient safety event reporting, lack of feedback or response to staff and others who report safety vulnerabilities, allowing intimidation of staff who report events, refusing to consistently prioritize and implement safety recommendations, and lastly, not addressing staff burnout.
I think those are all really important things to keep in mind. Now, can you maybe shed a little light? Why might nurses be hesitant to report errors or near misses?
So I think that nurses may hesitate due to fear of retaliation or getting in trouble. So even if that error was due to a system problem or it was an honest mistake, there's still that fear. So leaders in healthcare settings really need to create and promote a psychologically safe environment so that the need to report and do something about a safety issue far outweighs the fear of being punished.
I love that. And I think that's so important, that concept of creating psychological safety to feel like you can speak up when you yourself have committed an error and feel supported and feel as though your leadership will investigate the cause, the systemic cause of that error, and not look at it as like a personal failing or an intentional mistake. I think that's so important. And what I've experienced is that even if nurses feel comfortable or feel as though they're encouraged to speak up, if they keep doing that, but nothing changes, they don't see the impact or the outcome that things are getting better or changing because of those reports, then it starts to kind of chip away at a nurse's desire to keep reporting if it doesn't feel like it's making a difference.
I agree with you, Jamie.
So what steps can healthcare leaders take to help create that stronger reporting culture within their own institution or organization?
So in healthcare, we all need to move towards a transparent, non-punitive approach to reporting and learning from adverse events, close calls, and even unsafe conditions. So in order to achieve this, we need our leaders committed to prioritizing and making patient safety visible on a daily basis. So there are 5 components of safety culture that are defined by Chasten and Loeb. Those include trust, accountability, identifying unsafe conditions, strengthening systems, and assessment. So there needs to be an organizational-wide and easy-to-use reporting system that is accessible to all employees, because we want everyone to feel empowered to report a safety issue. There also should be employee recognition for event reporting and their demonstration and commitment to quality, safety, and communication. So leaders can utilize huddles on the units to recognize staff who report adverse events or near misses, for example, a good catch, and provide that real-time feedback and follow up on any events and near misses. And it's really important to do team safety briefings, huddles, or safety rounds and walkthroughs, because during these face-to-face interactions, it is so important to ask frontline staff about any immediate safety concerns or issues.
I think that's so important, the concept of that sort of huddle or debrief. Some might call it, a more formal approach to doing that root cause analysis, but we can't all learn from a mistake that occurred unless we talk about it and we share what the circumstances were, what it's been discovered in terms of how all of those many steps of the Swiss cheese model aligned for something to occur. And then we can integrate that into our own practice and hopefully do better next time and avoid some of those steps if possible. And so without taking that chance to kind of dissect the situation and what happened and then sharing that with the group, it's just a huge missed opportunity of learning and prevention of future errors. So I really think that's an important component. You also mentioned having that reporting system that is easy to access. And I think that's just another layer of, a nurse's busy day complexity. They're already having to document a million things in the clinical record, but this record lives outside of that. And what you put in that event reporting might be different, very important details that are not going to be part of that patient's medical record, but it's going to be a way to capture the scenario of what happened. And so it is important. It might feel like just one more thing to have to document, but again, just keeping clarity on the importance of this separate system and the information that needs to be there so that it can be shared with the larger organization, and these types of things can be learned from by all of your colleagues. So important things to keep in mind.
Yes, absolutely. And I think one thing that our organization does is they have the event reporting system available as a desktop icon. So it is very easy to find for staff, and they don't need to click in 20 different places to reach the event reporting system.
That's really important. It seems like a little thing, but man, those clicks add up. We all know that.
They sure do.
Anything you can do just to make it a little bit more streamlined is certainly, I'm sure, appreciated. So let's talk about the individual oncology nurse's role in helping to create and sustain this type of culture.
So oncology nurses should complete training on their employer's event reporting system first and foremost, so they know where to report any safety issues or concerns. And then they should utilize the reporting system for anything. So actual events that reach the patient, a near miss, or an unsafe condition. Take ownership of any errors and use these mistakes as opportunities for change to prevent it from happening again. Jamie, I know you mentioned it before that if one person's experiencing a gap or an error that happens because of a process gap, it may be happening to other people, but if it's not reported, we don't have that opportunity to fix it. And oncology nurses are really positioned in a great place to participate in debriefs and root cause analyses and share their expertise as appropriate to perhaps update current policies and procedures to prevent this from happening again. In addition, oncology nurses can participate in any unit-based huddles or meetings and work groups to provide their frontline critical feedback to prevent future errors or any concerns that need to be escalated to leadership or even senior leadership.
I think that's great. And you initially mentioned training, and I think that's such an important thing. It may not necessarily need to be an annual competency every year for all staff members, but integrating, and trying to keep top of mind the notion of when you see something happen or you've experienced an error or you just know that there's a risk, just keeping it top of mind. I need to go to my employer or my institution's reporting system. I need to enter this in. And so getting comfortable, like you said, knowing where it is, hopefully it is that convenient desktop icon, but knowing where it is, knowing how to navigate that system. You don't want to wait until you have your first big problem to try to stumble through how to use that system. And so anything that you can do to not only keep yourself familiar with what that system is, where to find it, and what information is going to be needed, then that will help you as you're experiencing these things as the nurse on the floor, then those types of details, I know it's not realistic to think that all of this documentation happens in real time. Sometimes we can't stop in the middle of exactly what we're doing to go to the reporting system. But if you're familiar with what input fields are there, what information they're going to ask about, then you can start to think through those things and kind of make your own notes so that when you do have that time to set aside and complete that form thoroughly, then you'll know that you captured the right information to make sure that that report is as comprehensive as it can be. So we've talked about our nurses' role. Let's talk about the patients. How can we educate our patients on the procedure and this culture of reporting to help promote safety?
So our oncology nurses are able to partner with their patients. So it's not just education on chemotherapy and side effects and treatment, but there's also a lot of education regarding safety. So safety while in clinic, receiving infusions, or at home. So it's important to educate patients on topics such as infection prevention. So one example would be to encourage our patients to speak up if something doesn't seem right. So for example, hand hygiene. If the patient sees that their clinician didn't perform hand hygiene after walking into the exam room, feeling empowered and encouraged to speak up. Also, nurses can talk to their patients about their treatment plan, perhaps address any discrepancies or gaps. Nurses can also educate the patients on the safety steps that are taken behind the scenes. So, for example, there are many checks in place for chemotherapy administration. Nurses can explain to the patient what is happening while they are waiting for their drug to arrive. And it's really important for leadership to also be available for patients if they identify a safety concern or issue, because patients may identify something to their nurse, but it may require further escalation. So it's really important for leadership to be available as needed.
I love the notion of just including your patient in understanding, what we're doing and why. I think it's easy for nurses. We live and breathe this environment. It's just our world. And so sometimes it's easy to forget that every step of the process that we're going through might seem foreign, certainly contribute to anxiety for patients if they're just not sure what to expect, or maybe, they've not been in the healthcare system very long. So not only does it help to hopefully put their fears at ease, but it also brings them in as just another layer of security. I mean, I would want my patients to tell me if they note something different on the way that I'm doing something with the way that they've had experienced it before. It might be totally fine, but I want them to feel empowered and safe to ask that question of, this looks different, or that's not the same. I don't remember the bag that you hung last time. It didn't look like that. Those are types of things that they might not have all the words to be able to explain exactly what this was called or how they did it. But if they know that it feels different or it seems like it's not the same, that can be enough for them to just raise that question and ask. And as I said, sometimes it's totally normal and we can explain why there might be some variation, but it might just be just enough for that patient to bring up something and allow us to catch something that's not going the way that it normally should be. So can you help elaborate on how the practices are currently changing or have been changed to help build a better reporting culture within institutions?
On the Joint Commission website, there are many examples of different healthcare institutions across the country that have improved reporting culture. Some examples include a just culture decision tree, rollout of an electronic event reporting system, revision of any existing human resources policies, and educational programs that are geared towards reporting culture. So at our healthcare institution, we have implemented the following to promote and sustain a reporting culture. And I think we kind of talked about this earlier: an easily accessible electronic event reporting system with initial training and regularly scheduled refreshers as needed, not just for staff, but also for leadership level. Safety rounds with senior leadership and frontline staff. We also have weekly high reliability organization messages from our chief medical officer. And those messages are great because they really can apply to any clinical setting. Even though we're a big institution with many different ambulatory inpatient, many different care settings, these messages really do have a common theme, which is great to share with our staff. And also, we do regularly scheduled unit-based safety huddles. So we review all events, near misses, and good catches that are reported out with the whole team.
And I think as you talk through all those great examples, it just, again, reinforces to me the importance of keeping the conversation alive, keeping the topic of safety and reporting and how those two things go hand in hand. The days get busy and a little crazy, and sometimes you have to prioritize what your top focus is. But all of those things that you've mentioned are just different strategies to keep the idea of a reporting culture and the importance of looking for safety risks and reporting them appropriately. It just keeps it at the top of the conversation so that it's not something that gets pushed to the back burner. So I think those are some great ideas. Thank you for sharing those.
Of course. And I just want to add that, of course, we do need to document and put the reports in, but I also think in real time, having that discussion with your colleagues and your leadership to really work through what is happening at that moment and then doing that debrief afterwards.
Absolutely. Some things you don't just want to put a report in and hope for the best. Like those are some things can and should be fixed immediately. And so it's important to understand, like, what are those things that if you see that you have to escalate immediately to your leadership, to your local colleagues, it just depends on what type of situation, of course, that we're dealing with. But you're absolutely right. Sometimes it's not wait until you put the report in. It's like, what do we need to do right now? And then how can we make sure that we document this appropriately in that system so that we can do that further exploration of all the factors that went into this situation. So definitely different layers of approach depending on kind of what the scenario is. Well, Klara, I really appreciate you coming back on our podcast today to talk a little bit more about safety and specifically this reporting culture. So as we wrap up our episode today, I will ask you just a few of those quick questions. To start things off, what are some common misconceptions about creating and promoting a culture of reporting?
One common misconception is that the reporter will be blamed for the event. We need to continue to remind everyone that reporting culture improves safety and that events are usually due to a system or process gap. We need to acknowledge and thank the individual who took the time to escalate their concerns and report the event. And there is a clear difference between a system gap and neglectful or at-risk behavior. I also think it's really important to remind everyone that near misses and close calls also need to be reported. Those instances provide us with critical information and allow us to correct any gaps before an actual event occurs.
I absolutely agree. And just want to recall what you said earlier that if you've experienced an error or a problem you're noticing, there's a good chance somebody else might have had the same thing. And so by you taking the steps to report and to make sure that it's addressed from a more systemic level, then, you can help your colleagues avoid, or your patients even avoid having that same scenario play out. So it's important to take the time and be the person to make that report. What's something about the topic that's not often discussed, but you wish people knew more about?
That we all have a role to play in identifying and reporting potential hazards. So that could be a piece of equipment that needs maintenance, a slippery floor that needs attention. We can all prevent harm and keep our patients safe. And buy-in from all staff is essential. And really, everyone has a role in reporting culture, not just the clinical staff.
Absolutely. And not all issues are clinically related. Sometimes they're environmental. They're just the places that our patients are in inside our building and our institution. So I love that it's the whole team, not just nurses. Certainly there's parts of the job that only nurses might see or understand the complexity of, but it's the whole team. And so encouraging and celebrating all of your colleagues as part of that healthcare team who find these issues and bring them up. It takes all of us to make sure that we can make the environment as safe as possible. What are some additional training or education opportunities for oncology nurses that they can explore to better understand, help creating a culture of safety or reporting? And are there any additional resources for even patients or providers who want to learn more?
So a culture change can be a long and challenging process, but it is extremely rewarding once achieved. On a local level, oncology nurses should be aware of their employer's policies and procedures and complete any required training on event reporting. Additional resources for both patients and oncology nurses include the Joint Commission website, where they can access Sentinel event alerts, Patient Safety Network, Agency for Healthcare Research and Quality, and the Oncology Nursing Society has a lot of great resources as well.
I think those are some great opportunities and resources for our nurses and our listeners to explore. And so thank you so much for sharing those. I think it's been a great conversation today, and I hope that all of our listeners have considered how they can potentially implement something a little bit different in their daily work to ensure that they're keeping the concept of safety and reporting culture at the top of their mind. Do you have anything else to share for our listeners today, Klara?
Both oncology nurses and oncology nursing leaders, it is so important for all of us to foster a culture where all employees feel empowered to report and address concerns without fear of repercussions. This includes encouraging open communication channels, actively listening to feedback, and proactively identifying and resolving operational issues to prevent them from escalating into serious patient safety problems. By working together, we can all maintain a safe and secure environment of care for our patients.
Wonderfully said. Thank you so much for joining us today, Klara.
Thank you for having me, Jamie.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part in this episode by leaving a review wherever you download your podcast. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org. The ideas and opinions shared in this episode represent those of the guest and not necessarily ONS.